Good day everyone, my name is Sanchez, BSN-2A, and for today, I'm going to perform a demonstration on how to perform catheterization for both female and male. So catheterization is defined as the introduction of the catheter through urethra into the bladder for instilling or removing fluid. At the same time, the purpose of catheterization is to control urinary incontinence, at the same time to relieve urinary retention. So for this time, I am already done to perform hand hygiene in order to eliminate the microorganism, and privacy for the patient is now secured. So before we are going to have the procedures for the catheterization, let me introduce first all of the equipment that we're going to use for this type of the procedures for catheterization. So the first thing that we have for equipment is this one. This is the alcohol swab. We have this one. This is for a stabilizer lock. We have also for the working gloves. We have the ethyl alcohol. We have also the alcohol cotton balls, and then this one to be as lubrication spray. We have this one. This is a kidney basin. Okay, this is an improvised forceps, and also we have the sterile gloves. We have this one. This is a lubrication cup. So as you can see, this box, so this is what we call the catheter kit, which is inside the catheter kit we have the drape, the fenestrated drape, and also we have the 10cc syringe, and also the catheter size 16 and the urine bag itself. And also I have here my medication order. So now we are done to introduce all of the equipment that we are going to use for this type of procedure. So for this time, I'm going to the patient room. So let us assume that we are now in the patient room. So as you can see, my patient is laying on her bed, which is in a supine position. So good day, ma'am. My name is Sanchez, and I am your student nurse for today. Ma'am, can I ask you some questions?
Yes.
Okay. What is your full name?
My name is Nora Amor.
Okay, good. How about the date of birth?
December 13, 1999.
Okay. So after we ask for the full name of the patient, at the same time for the date of birth of the patient, let us now check for the medical orders of the doctors. So I have here the medical orders, so that we're able to determine or to confirm that the name stated in the medical orders are the same to the given name by the patient. And at the same time, we are not able to conduct the catheterization without the medical orders. So the medical orders stated name Nora Honor, and the date of birth is December 13, 1999. So for this time, I am confirming that my patient is the same, so she is able to have my catheterization. So we are going to set aside this medical order, and for this time, I'm going also to assess the patient's allergies. So ma'am, can I ask you some questions?
Yes.
Okay. Do you have any allergies towards seafoods, shellfish?
No.
How about do you allergy with the plastic, plasters, something like that?
No.
Okay. How about when was last you urinated?
Last night.
Okay. So I am here, ma'am, because there is a medical order where I am able to have catheterization to you in order to control urinary incontinence. Is that okay with you?
Yes.
Okay. So do you have any questions about catheterization?
It is hard.
Ma'am, this is a quite difficult, but all you have to do is to cooperate with me in order to make the flow of the procedure easier. I am here to assist you. I am here to help you, okay?
Okay.
So do not worry about the procedure itself, okay?
Okay.
Okay, thank you. So for this time, I am going to perform the pericare for the patient. In performing for the pericare for the patient, we need for the cotton balls, And also we have the basins containing disinfectant solution, and also this one, this is the forceps. So as you can see, my patient is laying on supine position, requesting the patient, ma'am, please place your position into dorsal recumbent position, and please make your feet apart so that I'm going to have my pericare to you, okay? I'm going to assist you. So as you can see, the private part of the patients is now exposed. So the next thing that we're going to do is to perform hand sanitation. Okay. I already have a good lighting. At the same time, privacy for the patient is now secured. So for this time, I am done to have the hand sanitation. So the next thing that we're going to do is to insert for the working gloves. So ma'am, I'm just wearing my working gloves, okay? Because I am going to have a pericare, okay?
Okay.
So the pericare itself has two reasons. First is for inspection. At the same time, this is to cleanse for the portions of the private part of the patient. So all we have to do for this procedure is to collect all of the items that we're going to use. So I have here my forceps, and the next thing that we're going to do is to grab or to pick up cotton balls, and at the same time we're going to soak it with disinfectant solution. Okay. So now, my non-dominant hand, I'm going to use this to spread for the labia of the patient. So as you can see, I'm going to spread for the labia of the patient. And for the cotton balls that we're going to use is to clean for the top and for the lower portion of the labia of the patient. Okay. So how are you, ma'am?
I'm fine.
Okay. And then after that, we're going to dispose it to the trash can. Same procedure that we're going to do for the second cotton balls. We're going to soak it with disinfectant solution, and then for the second time, we're going to clean for the labia, top and the bottom of the labia. And then after that, we're going to dispose it immediately. And then after that, for the third cotton ball, this is the last balls. I'm going to soak it with disinfectant solution, and then after that, for this time, I'm going to clean for the middle portion of the private part of the patient. How are you, ma'am?
I'm okay.
Okay, thank you. So after we are able to perform the pericare for the patient, I'm going to remove my working gloves. And then after that, I'm going to dispose it immediately. Okay. So for this time, after we are able to have the pericare for the patient, the next thing that we're going to do is to open for the catheter that we have. This is the catheter kit. In opening for the catheter kit, we are going to open for the upper portion of the catheter kit, and then after that we're going to open for the left and the right side, and then the lower portion of the catheter kit. So for this time, okay, the equipment that inside the catheter kit is now exposed. So for this time, I'm going to sanitize my hands again, because for this time I'm going to wear or to don my working gloves. This is sterile gloves. How are you, ma'am?
I'm okay.
Okay. Do you feel nervous?
No.
Okay. Do you have any questions about the procedure itself?
Nothing.
Okay. Do you enjoy it?
Yes.
Okay, thank you. I'm just wearing the sterile gloves because I'm going to have the cutlery, which is sterile.
Okay.
So as you can see, the cutlery kit itself is not exposed, so I am now able to handle all of the equipment inside for the cutlery kit. So the first item that I'm going to pick up is the drape. So before that, I'm going to place it to the trash can to make the surrounding clean. And then after that, yes, I have here my this is a drape. Okay, so the drape itself has two sides, which is the shiny, and then we have for the not shiny. Okay, so this portion is not shiny, it's absorb water. Okay, so for this time I'm going to insert it to underneath of the patient. I'm going to wrap the drape something like this. Okay, so for this time I'm going to insert it to underneath to the patient. So here, so ma'am, please assist me. So please raise your waist. I'm going to insert it. Okay, ma'am, please resist. Okay, thank you. Okay, now, so as you can see, the drape is now inserted underneath the patient. So for this time, I'm going to grab for the fenestrated drape. Okay, so this is the fenestrated drape. Okay, so the purpose of the fenestrated drape is to provide more privacy for the patient, at the same time to widen for the sterility of the area. I'm going to attach it towards the center. Okay, now, so the fenestrated itself is now intact. So the next thing that we're going to do is to take for the sterile gloves. This is a syringe, 10 cc syringe, which is contain distilled water. So for this time, I'm going to detach it, and then I'm going to pull it back to break the tip of the syringe, which is this syringe contain 10 cc distilled water. And then after that, we're going to set it aside. Okay, so the next thing that we're going to do is to have here. We're going to insert for the 10 cc syringe to the catheter, size 16. Okay, so for this time, the catheter and the 10 cc syringe is now connected. So on the other hand, I'm going to have the second stage of the cleaning. So I have here the alcohol swabs, and then also we have the lubrication spray, and then we have the lubrication cup. Okay, so the next thing we're going to do is to open for the alcohol swab immediately, one by one. We're going to use for 3 of the alcohol swabs. Okay, already done. And then we're going to spray a little amount of lubrication to this cup. And then after we have the small amount of the lubrication, I'm going to place the tip of the catheter to the lubrication in order to maintain sterility and to make it more easier to insert. So for this time, I'm going to hold the catheter 2 to 3 inches long. I'm going to place it to the lubrication spray, the tip of the catheter. Okay, so for this time, I'm going to use alcohol swab to clean for the second time for the private part of the patient. So now, ma'am, I'm able to have the second stage of cleaning. Is that okay with you?
Yes.
Okay. So I'm going to clean with alcohol swab. Okay. I'm going to use this one, and we are going to use our non-dominant hand in order to spread for the labia, and then we are going to use this alcohol swab to clean for the left and right portion of the labia here, and then dispose it. Next, we have the second round for the alcohol swab. I'm going to dispose and then spread the labia and then clean for the left and right portion of the labia. And then we're going to dispose it. And then for the last alcohol swab that we have, all you have to do is to clean for the middle portion of the labia. Are you okay, ma'am?
Yes.
Okay. Do you feel nervous?
No.
Okay. So this alcohol swab, I'm going to dispose it. So for this time, I'm going to set aside all of the equipment that we're going to use for the catheterization. So mom, now we're going to insertion. Are you ready?
Yes.
Okay. All you have to do is to cooperate with me, okay?
Okay.
And everything goes well, okay?
Okay.
Okay. So for this time, I'm going to hold for the catheter 2 to 3 centimeter inches long, and I'm going to spread for the labia of the patient. Okay, ma'am, please help me. I'm going to insert it in 3, 2, 1, and please take a deep breath. Okay?
Okay.
If I'm going to say take a deep breath, you're going to do that. Okay? Okay. So we're now ready for insertion.
Okay.
Okay, please take deep breath in 3, 2, 1. Okay, so continue inserting until we see urine flowing to the catheter line or tube. Okay, I'm going to make sure that the catheter is intact. Okay, it is not moving, because it is moving, it means that there is a possibility that it is not placed in good position. Okay, after I'm making sure that the catheter itself is successfully inserted, I'm going to insert for the I'm going to insert for the distill the water gently. You okay, ma'am?
Yes.
Okay, thank you. So after inserted for the 10 cc syringe, we're going to set it aside. And then for this time, I am going to have my urine bag. I'm going to place it to the side railings of the patient, okay? Here, in this portion. Are you okay, ma'am?
Yes.
Okay. And I'm going to use this one in order to paste it, in order to prevent it moving. Going to use scissors to cut it, and then we're going to place the urine bag here. Hold on, ma'am, we're already done.
Okay.
Okay. You okay, ma'am?
Yes.
Okay. Everything's well?
Yes.
So after we have to hold for the urine bag of the patient, I'm going to break or to smash down the penetrated drain that I have inserted. I'm going to remove it, ma'am.
Okay.
Please hold on. And then after that, we're going to dispose the penetrated drain. Okay, so for this time, I'm going to collect all the equipment that I have in the use. You okay, ma'am?
Yes.
Okay. So after we have to place for the urine bag of the patient in the side railing of the bedroom, before leaving the patient, we are going to ask her if she is comfortable. So ma'am, are you comfortable now?
Yes.
Okay. I have here the equipment that I have. I'm going to arrange it after. I'm going to make it sure that everything is good, everything is well.
Yes.
Okay, thank you. So I'm going to cover you with a blanket in order to have the security that you have, okay? Okay. So, but before that, I'm going to make sure that the lock itself is attached to you, okay? In order to provide it more comfortable, okay?
Okay.
Okay. Please place your feet to this one portion. You okay, ma'am?
Yes.
Okay. So for this time, I'm going to use another set of the lock in order to make it the patient comfortable. Do you have any concern?
No.
Okay. Please help me. You okay, ma'am?
Yes.
Okay. Do you comfortable now?
Yes.
If you have concern or any suggestions, so please don't hesitate to push the button beside you
Okay.
in order to notify us. Okay.
Okay.
So after we make sure that the patient is now in a comfortable position, we are going to remove the cereal gloves that we done. We're almost done, ma'am.
Yes.
Are you happy?
Yeah. Maybe.
What's the feeling of catheterization?
It's fine.
Okay. After that, we're going to dispose it to the garbage can. Okay, so we are already done to perform the catheterization for female. So that's all for the catheterization for female. So we are already done to perform the female catheterization. So for this time, we are now going to have the catheterization for male. So the procedure itself for the female and for the male is the same. Okay. So the first thing that we're going to do for this procedure is to ask the patient his full name. So, ma'am, sir, rather, what is your full name?
Lito Butan.
Okay. When is your date of birth?
March 11, 2000.
Okay. So for this time, I'm going to compare it with the medical orders in order to confirm if he is the patient that able to have the catheterization in order to have the basis, because we are not able to conduct catheterization if there is no medical order coming from the doctor. So the medical record itself, the patient's name stated is Lito Butan and the date of birth is the same. So I'm now confirming that the patient is able to have the catheterization. Okay. So the next thing that we're going to do is to assess the patient if he is allergic to certain types of seafoods. Okay. So ma'am, sir, do you have any allergies towards shellfish, seafoods?
No.
How about lubrication? How about plastic?
No.
Okay. When was you last urinated?
Last night.
Okay. So for this time, I'm going to explain the procedures towards the patient. So for this time, sir, I'm going to have your catheterization because there is a medical order in order to control urinary incontinence. Okay.
Okay.
Okay. So I want your cooperation. So do you have any questions about the catheterization?
No.
Okay, thank you. So for this time, we're able to assess for the patients. So the first thing that we're going to do is to have the pericare for the penis of the patient. So the first thing that we're going to do for the pericare is to sanitize our hand in order to eliminate a microorganism. At the same time, with the help of hand sanitizer is to make the hands sterile. Okay, so for this time, I'm going to wear my working gloves. So I'm just inserting my working gloves because for this time, I'm going to have the pericare, okay?
Okay.
Okay. So the patient itself is placing or laying on a supine position. So requesting the patient to please place the position into the dorsal recumbent position, which is the feet placing apart. So sir, please place the position into the dorsal recumbent position. I'm going to help you. Okay, so the private part of the patient is now exposed. So please, sir, help me. I'm going to set apart your feet. Okay. So for this time, the private parts of the patient is now exposed. So the equipment that we're going to need for the procedures is that we have for the cotton balls, we have the forceps, and a basins containing disinfectant solution. So the first thing we're going to do is to grab for the forceps, and then we're going to pick up one cotton balls, and at the same time we're going to soak it with disinfectant solution, and we're going to clean for the penis. Round to clean for the entire surface of the penis. And then after that, we're going to throw it immediately to the garbage. So for the second time, we're going to do the same. Okay. Take the cotton balls, soak with disinfectant solution, and we're going to clean for the penis of the patient. Are you okay, sir?
Yes.
How's doing?
I'm fine.
Okay. So for the last cotton ball, we're going to do the same. I'm going to dispose this. So now we are already done to perform the pericare. I'm going to remove my working gloves. And then we're going to throw it immediately to the garbage. So the next thing that we're going to do after we perform the pericare is to have the catheter kit open. So there are a rule if you open for the catheter kit. So we're going to open for the upper portion. Next is the left and the right portion and the down portion of the catheter. So for this time, so the sterility items of the catheter kit itself is now exposed. We are not going to use our non-sterile hands to hold it. So next is to have the hand sanitation, and then for this time I'm going to wear the sterile gloves. So I'm just going to wear for my sterile gloves, okay? Are you okay, sir?
Yes.
Okay. How's doing, sir? Are you okay?
Yes, I'm
Okay.
fine.
You have the catheterization. Are you ready?
Yes, I'm ready.
Okay. So for this time, I am able to wear my sterile gloves. So for this time, I'm going now to have the time to have to hold for the equipment inside. Okay, the equipment inside is we have this one. This is the fenestrated ray. Okay, so it has two parts, which is the shiny and the not shiny. The not shiny absorb water, and then after that we're going to place it underneath the patient. So sir, please help me. Please raise your waist. I'm going to insert this one. Okay, thank you. So the drape, as you can see, are able now to insert it. So for this time, I'm going to dispose it properly. And then after that, we're going to insert for the fenestrated drape. So the purpose of the fenestrated drape is to provide more privacy to the patient, and at the same time, this fenestrated drape is to to widen the sterility of the area. So sir, I'm going to place this. Please hold it. Okay, so for this time, I'm going to have the 10 cc syringe itself. Okay, the 10 cc contain distilled water. I'm going to open it, and I'm going to push it back in order to make the 10 cc syringe break the tip of the syringe. And then we're going to set it aside. And then we are now going to find for the catheter size 16, and then we're going to have insert it or to attach it. Always remember that do not inflate. And then okay, finally the 10 cc syringe and the what we call this, the catheter, is now connected. So I'm going to set it aside. On the other hand, I'm going to prepare for the alcohol swab, and also we have this lubrication spray. This is a lubrication cup, and then we have the lubrication spray. And I'm going to take for the 3 of the alcohol swabs here. And then I'm going to open it one by one immediately. Okay, so in the meantime, we are now going to spray little amount of the lubrication to this lubrication cup. Okay, so for this time, I'm going to take for the catheter size 16, and I'm going to remove the wrapper of the size 16 catheter. Okay, and then we're going to hold for the catheter 2 to 3 centimeter inches long, and we're going to dispose it. And then after that, we're going to place or to take this one together with the urine bag. And then I'm going to place the tip of the catheter to the lubrication in order to make it more easier to insert it. And at the same time, the purpose of this is to maintain sterility. Okay. So for this time, I'm going to clean for the patient private part. So for this time, I'm going to have the second stage of cleaning. Is that okay with you, sir?
Yes.
Okay. So I have here the alcohol swab, and then we're going to use this to clean for the surface of the penis. How is today, sir?
I'm fine.
Okay. I'm going to clean for the surface of the penis. And then we're going to dispose it immediately. Same thing that we're going to do is to use alcohol swab to clean for the surface of the patient. Dispose. Lastly, this is used to clean for the center portion of the penis. Are you okay, sir?
Yes.
Okay. So for this time, we're going to dispose it. Okay, so for today, I am able to have the second stage of cleaning for the penis of the patient. I am now bringing this item to the patient's bedroom. So, sir, we are ready for insertion. Are you ready?
Yes.
Okay. So for this time, I'm going to hold for the catheter size 16, 2 to 3 centimeter inches, and I'm going to insert it towards the penis of the patient. So are you ready, sir?
Yes.
I'm going to insert in 3, 2, 1, and you have to do an inhale and exhale, okay?
Okay.
All you have to do is exhale if insertion is ongoing, okay?
Okay.
Okay, so please take deep breath. Okay, ready for insertion and 3, 2, 1. Please exhale, inhale, exhale. Okay, good, Mr. Little Bhutan. Okay, all is good. Okay, very good. Okay, so after the catheter inserted towards the penis of the patient, we are now going to insert the distilled water of the syringe. You okay, sir?
Yes.
Everything's well?
Yeah.
Everything's good?
Yes.
Okay. Okay. I'm going to detach it and going to place this one to this portion. Okay. So after we have inserted, I'm going to assess for the urine bag of the patient because we are going to place the urine bag side railings to make it more comfortable. Before that, I'm going to place it to the side railing of the patient. I'm going to break the penetrated rate. And I'm going to dispose it. Okay, so for the meantime, I'm going to place this urine bag. And we have for the forceps, okay? This is a forceps. Are you okay, sir?
Yes.
Do you have any concern?
No.
Okay. Everything is well?
Yeah.
Very good. Another one. To make it sure, we're going to make it 3. Okay. Observe also the lining of the tube if there is a urine flowing towards the urine bag, and all you have to do is to observe the urine inside the bag if there is urine inside, and we're going to note for the characteristic, the textures, the color of the urine, the volume itself. And then we're going to set it aside. And then for this time, I'm going to attach the stat-lock stabilizer to the patient in order to make the patient more comfortable. Are you okay, sir?
Yes.
Okay. I'm going just to insert for the stat-lock in order to make you comfortable.
Okay.
Okay. Please straight your Are you okay, sir?
Yes, I'm fine.
Okay. Okay. So after we attach for the stat-lock stabilizer, we're going to have this equipment placed here. Please have it made straight. Okay, and I'm going to roll it up in order to make it. Is it okay? I'm going to.
Yes.
Okay. Okay. So for this time, before leaving for the patient, we are going to ask if the patient is comfortable. So, sir, I am able to have the procedures. Okay, do you have any problem?
Nothing.
Okay, are you comfortable now?
Yes.
Okay, thank you.
Thank
If you have any concern, so please push the button beside you in order to notify us if there is concern, okay?
Okay.
Okay, thank you. So for this, I'm going to arrange all of the equipment that I have used. Dispose the things that is not good to have. Okay, so after that, we're going to remove 4 the steel gloves that we have. Going to dispose this. So that's all for the catheterization for both female and male. Thank you.